than cheeks, that's definitely up. Stem cells is derived from your own fat that we inject it back to your face. Fillers online, Botox online.
Hello and welcome to The Spills, a queer pop culture chat show from Gay Star News. I'm journalist Helen Merrill Thomas, and today we are going to be talking about a viral TikTok rumor, meme question about whether or not celebrities are taking the substance. And obviously by this we mean the Demi Moore film, the body horror film, which came out this year, in which you can take a mysterious substance which unlocks a younger, more beautiful version of yourself. And what has triggered this meme is a slew of videos and photos of celebrities, not naming any specific names, who have seemed to have de-aged 20 years overnight and basically look incredible, but they don't look like they've had crazy fillers, they don't look like they've had crazy Botox, but they look like they've unlocked something else. So joining me for this discussion today is Dr. Vincent Wong. Nice to see you, Dr. Vincent.
Thank you for having me. Lovely meeting you too.
Very welcome. So you are a cosmetic surgeon, facial doctor?
Yes, so facial aesthetics doctor.
Okay, and you specialize in what?
So I mainly perform non-surgical procedures.
Okay.
So anything from sort of like anti-wrinkle, anti-aging, improvement of skin quality, all the way down to sort of like minor surgery, like, you know, cysts and skin tight removals and stuff like that.
Okay.
Yeah.
And would you mind telling the cameras how old you are?
I am 40 years old.
Okay. Well, you don't look it.
Oh,
so
thank you.
who better to join me for this discussion?
Thank you.
First question, are celebrities taking the substance?
In a way, yes. So I don't think the substance exists as a one-off quick fix like what we saw in the movie. But I think with the advancement in technology and things like that, I think we can achieve something pretty similar by combining different treatments and timing it perfectly well. So, yeah.
So the thing that some people have been saying is that there's a trend now for having all your surgeries sort of at once, like either in a day or a week or a month, rather than over like a 6-month period or 1 year period, as you might have seen historically. So is that true? Is that reflected in what you're saying?
Yes. So I think with kind of like treatment planning and things like that, working together with the patient to find out their schedule, downtime, etc., is very important. So some people are not able to have sort of long downtimes and things like that. So for those kind of patients, it would be better to do little procedures, but often. So then the downtime is only sort of like 1 to 2 days or 2 to 3 days rather than weeks and weeks off. But for those who can afford the downtime, then yes, having everything done together would give you a much better result, quicker recovery. And, you know, you can just go out and have that dramatic after, you know, results.
That red carpet look that gets everyone talking. So what are some of the treatments that celebrities are going for now? Is it your traditional sort of fillers, or is it something a bit more advanced?
Definitely something more advanced. So I think the traditional or the classic kind of toxin and filler and things like that, there is still a place for it, but I think the demand, especially for fillers, are going down. And people are looking for more sort of like regenerative kind of treatments. So now the trend is moving towards sort of like skin quality improvement, stem cells, you know, skincare, and also debulking the area. So rather than filling, making the face bigger, we're trying to make the face smaller. So it gives a more natural and tighter results as well.
Okay, wow, that's really interesting. Like the idea of sort of slimming the face down to avoid that like pillow face look is kind of interesting, the way that that's almost reflecting also like body image trends and fashion trends. And how that's now reflected in our faces.
Yeah, definitely. And there's so many new devices that have come out in the last year that can really effectively shrink the soft tissues and give you a better, tighter face and body as well. Yeah.
Okay. Can you tell us a bit about what those are? You're keeping your secrets.
I know. So I'm one of the first doctors to introduce a treatment called Quantum. So this is by a company called InMode, that is the makers of Morpheus 8. So it uses radio frequency to actually shrink the tissue. So the benefit of using quantum is that with each pulse we deliver, we're reducing the whole area in a 3D way by about 0.03 mils. So each time we do it, we reduce the volume by 0.03 ml. And with a full face, you're looking at about probably 40, 50 shots. So it really adds up and it really contracts the tissue very well. And that's a very popular treatment for the lower face, the neck region, and also for the body.
So it almost feels like the sort of skincarification of cosmetic surgery, i.e. getting a lot more scientific, really getting into cell regeneration rather than just kind of puffing up.
Yes, absolutely. So right now we have the option to look at aging from a hardware and software kind of perspective, which I think is quite cool, because previously we have only been focusing on the hardware kind of aspects. So looking at the actual skin laxity, volume, so on and so forth. Whereas now we can actually treat the skin with microRNAs, so genetic material, just to tell the skin cells to behave younger.
This is sounding very substancy.
Exactly, yes. But as I said earlier, it's done in a very different way, but you can get a similar kind of results.
Okay.
Yeah.
So it's not just like getting an injection that is green, but you are getting really into like the science of what your body is doing on the inside.
Absolutely. And now we can combine everything from regenerative medicine to what we already know, like toxin and fillers, and all the way down to surgery and energy-based devices. So the combination of all four aspects is going to achieve really amazing results. And more importantly, natural looking and undetectable.
Another theory that's been kind of posed is that this is just the younger generation seeing what a good facelift looks like. Because, I mean, from my age, I'm 29, and I really associate the facelift with like 10 years younger and the noughties and like getting a really pulled back look.
Wind tunnel.
Yeah, exactly, the wind tunnel look. But obviously now technology's moved on a long way. Deep plane facelift.
Yes.
If you wouldn't mind explaining what that is for the audience and just in general, what the place of facelifts is in the modern age.
Okay. So deep plane facelift is a facelift technique that targets, obviously, the SMART layer, which is kind of deeper. So normally in anti-aging, especially non-surgical setting, we target the skin and the subcutaneous fat underneath, right? And below this fat level, we have our muscles, and then we have the SMART layer, which is a layer of connective tissue that has a little bit of fat, a little bit of tendon, and a little bit of connective tissue. So by targeting this layer, we can effectively lift the entire face up. So by just targeting the deeper layer rather than the more superficial layer. And that is what deep plane facelift is. It's a very effective treatment. However, it is invasive. And, you know, the downtime could be a few weeks or a few months, depending on how severe it is. But at the end of the day, it is surgery. It involves, you know, downtime, recovery. You know, it's done under general anesthesia, so obviously there are risks associated with that as well. And I think there will always be a demand for facelifts, for surgical facelifts, especially for people who probably haven't started their aesthetics journey as young as people nowadays. However, I feel like the demand for it will continue to decrease because there's so much more that we can do to patients who are younger now, so it's more preventative. And then also with time, if you have like repeated treatments and things like that, we can effectively maintain your youthful looks for much longer these days. So that reduces the need for proper facelifts and things like that.
Okay, wow.
Yeah.
Is fat transfer also getting more popular?
Yes. So fat transfer, there are many ways of doing it these days. So, you know, like how we talked about the stem cells treatment, the microRNAs, there's also a version of this treatment where you can take your own fat and then we process it. And what we call nanofat is basically stem cells that's derived from your own fat that we inject it back to your face. Okay. Yeah. So there's so many things that we can do.
One substance that we know is gaining popularity in Hollywood is Ozempic.
Yes.
or Wegovy, or whatever they call it. And this is obviously the medication, which was originally designed for diabetes patients, but has been prescribed off-label for weight loss, and is very effective and good at that for especially overweight and obese patients, but is increasingly being taken by people who are not, and who are, if anything, you know, maybe underweight, and this is kind of pushing them further towards that. There's something called Ozempic Face.
Yes.
Which is, I think, kind of, or at least called online that way because it gives you quite a hollowed out look, especially if you're underweight to begin with or average weight to begin with. Pale skin, not much fatness in the face. I wonder how that's affecting your industry, whether you've noticed this. Is this a thing?
Absolutely. So I think Ozempic is a double-edged sword because on one hand, it's very effective in terms of reducing appetite, reducing your weight, etc. And actually, there's a lot of synergy between diabetes and aesthetics. So a lot of medication that's used for diabetes can actually be used for aesthetics because it works in an anti-inflammatory way. And we know that inflammation causes a lot of aging, right? So there's definitely some synergy between the two. However, as we know, it's often misused by the general public, right? So people who are not necessarily indicated for Ozempic, for example, are having it just for cosmetic reasons, or people see it as a quick fix, or as an alternative to going to the gym. But those are completely untrue, and that's not the way that Ozempic should be used. So if someone wants to have Ozempic, generally they have to have like a blood test and things like that to check their underlying medical health, so to speak, and to make sure that they have no contraindications for it and things like that. And for those people who are using it purely for weight loss, especially if they're quite small to begin with, can experience Ozempic face, and that comes in many different forms. So it can either be very gaunt look, or for people who have lost a lot of weight very quickly, they get excessive skin laxity, especially in the lower face. So on one hand, you get, well, the body or the figure that you have always wanted. On the other hand, you're losing volume from your face, so it makes you look older. And this is something that I've seen increasing in my practice as well. So depending on what they're hoping to achieve and what the final outcomes are, this can be treated using either, the exosomes to improve the skin quality, a tiny bit of filler just to replace a little bit of the lost volume, or it could be used with Quantum or Morpheus 8 radio frequency to tighten the skin. So depending on what it is, then we can target the specific layers of the skin to achieve a specific aesthetics goal. But definitely the rise of Ozempic face is a real thing.
Is it something which you're having to have conversations with your patients about?
Absolutely. So even when I prescribe weight loss injections, either Mounjaro or Ozempic, I often consult them about the impact that it can have on the face, and the importance of going it in a slow, progressive way. So start off with a low dose, see how they feel, and then we progressively fine-tune it every month to reach to the optimum dose for them. Yeah, and I think that part of the care is very important.
Okay.
Yeah.
There's an increase in people taking it just from buying it off like Facebook Marketplace and stuff.
Absolutely.
Have you encountered that at all?
Yes. So I've had people come to me. So during the consultation, they would say something like, "Oh, I've lost a lot of weight in a very short period of time." And traditionally, the first thing that comes to my mind would be cancer, right? Because there's this one disease that have been honed in so much during medical school that the first sign is weight loss.
Yeah.
So I found increasingly in the last 2 years is that people are like, no, I'm in perfect health. I just had Ozempic.
Okay.
Yeah. So and what I find terrifying, especially in the UK, is how unregulated these things are. So as you say, people can buy Ozempic online. People can also buy fillers online. They can buy Botox online. And you don't really need a proper medical qualification in the UK to do aesthetics. So it is very dangerous, and I think people should really do their research and their homework on anything they inject into your body, whether it's the skin or to reduce your weight and stuff like that, because these are medications and there can be side effects, and not everyone is suitable for it.
Yeah, crazy. I think another aspect to this that we should talk about is filters.
Yes.
And also AI filters, especially even on videos, are getting really good now, like almost undetectable. And I think with this question of whether or not the celebrities are taking the substance, there's an element of it which is we don't actually really know what they look like unless you've stood right next to them and seen what they look like. And maybe, they can apply filters to videos that they post online. They can face tune themselves very expertly. So it might not be as pristine as it seems.
Yes.
And then the other side of that is obviously that like filters and AI filters are changing how we see ourselves. And so how has that affected your practice?
So I have had a lot of patients who come in with a filtered photo. So it has progressed from coming in with, let's say, Angelina Jolie and say, I want to look like her, or Kim Kardashian, to coming in with like a filtered photo. I'm like, make me look like this. So there's a big change that I've seen. And, like I always tell my patients that, yes, we can achieve something close to that, but it's quite difficult to achieve the exact look, right? So things that can help would be skin quality improvement. So things like pore size, skin tone, and things like that. Something that we can definitely achieve with different medical treatments. And that is one of the aspects of filtering as well. And the other thing is facial volume. So we really look at the proportions of the face, facial harmony, facial balance. And sometimes you get patients who get very addictive with filler injections, especially in the lips and cheek area. These two are the most common areas, but it's an education piece, and everyone learns in a different way. So some patients will be more drawn to before after pictures. Some people are more drawn to text. Some people want to know how it feels under the skin. So it's important to have all these tools available to provide the information and to make sure that the information is delivered effectively to the patient. And also there are things like makeup that can help as well to achieve that filtered look. So it really depends on how they present. So whether they come in with a good skin quality or really poor skin quality, where they have things like acne, rosacea, then it's about looking at their diet, their exercise, and what products they're using on their skin. So it's not as straightforward as give them a quick jab and then you look filtered. It's a work in progress and it takes time.
Would you recommend that people stop using TikTok or Instagram AI filters when they're making videos?
That's a very personal thing, right? Because, we all want to look good, right? Especially on social media and stuff. But then there's the danger that using all these filters and things like that would really add more pressure for us to look good in real life. Because obviously, coming back to the celebrity references and things like that, what we see is obviously could be filtered, right? And also there was makeup. And we have not really seen these celebrities without makeup and close, like face to face, right? Their skin quality might be really bad. They might have big pores, for example, that can be covered quite effectively with makeup. So, it's understanding that there's more than what you see, right? So I think the use of filter is good when the user is fully well informed of what the filter means, and also knowing that you can improve your appearance in real life, but you shouldn't compare it to a filtered look. Yeah, I think that piece of information is missing currently. Yeah, and I think people are just using filters to make them look better, and then they change the way they see their face, and they become more critical about their appearance. and then looking at posts from other people and things like that, and they all look perfect, it just makes you feel even worse because you're like, oh my God, I do not look like that. What's wrong with my skin? I need help. I need this, I need that. But in actual fact, yes, medical aesthetics does work, and there are things that we can help move you towards that target. But then there's a lot more than that as well. It's not just medical aesthetics.
I mean, this is kind of the thing, right? It's like, damn, if Christina Aguilera can like wake up one day and look like she's de-aged 23 years, and I'm not saying that we don't know what she's done. She might not have done anything, like we're not speculating specifically on what she's done.
Yeah.
But like, if that is possible, then what hope is there for us non-superstar pop stars? Like, I think there is a big question right now of why does no one look like pictures from the 50s anymore?
That's true. Yes, that's a very good point. I think it comes back to how accessible aesthetics are, right? So aesthetic treatments in particular. So when I remember when I first started many, many years ago, Botox and fillers are something that people have. I don't really talk about it. And I think that is dangerous as well, because then, people will be like, oh my God, if they age like that, then why am I aging differently, right? And I think these days, obviously, there are more service providers, and it's more accessible. The pricing of things have gone down massively. And I think more and more people are thinking about having procedures because of what they read online, what it can achieve, etc. And I think patients are becoming more savvy with technology, with the information they can get. And a lot of my patients come in knowing exactly what treatments they want, or the treatments that can help them achieve their goals. So in a way, there's more awareness around it, but I think the mental health aspect of it is still very important. And it's a matter of how you see yourself. So having a very healthy mental health status to begin with, and also being happy in your own skin is very important. And that doesn't necessarily mean just looking flawless, right? It's about balancing everything in life. And then if you feel like your outer appearance does not reflect your inner self, that's when medical aesthetics fully come in. And I always say to my patients that my aim in clinic during any treatment is to match how they look to how they feel on the inside. And that is whether you identify as male, female, non-binary, whatever skin color you have, whatever age you are, it's to match how you feel on the inside.
What kind of questions should estheticians be asking someone before they get a beauty treatment?
So, firstly, the usual medical questionnaire, medical health, any allergies, etc., etc. Once that part is done, then it's when the real cosmetic consultation begins. And this is when you ask them what concerns they have with their appearance, what they are hoping to achieve, timeline, motivation behind it. So some people could come in and say, I just gone through a really bad breakup and I want to, improve myself. And you often find that, the motivation is not to self and from self. It's always from self to someone else. Yeah. And those are the patients that I would say, okay, your frame of mind is very important when it comes to aesthetics procedures, because if you're not in the right frame of mind, even the best procedure in the best hands can give you the wrong results, right? So often for patients that I feel have gone through a huge emotional trauma or significant life events and things like that, I generally slow them down. I'd be like, okay, take some time to think about this. These are the options that we can provide. So treatment plan A, treatment plan B, treatment plan C. These are the timelines that we're looking at. These are the results that we can achieve. But have a think about it. Let's not rush into it. Whereas if I find that someone is very stable emotionally and they just want to look after themselves, and we can then have that treatment in the same day. So delaying that treatment actually works quite well in my practice. Yeah.
So basically, don't just go to the first like nail bar that will give you filler.
Definitely not. Do your research. I mean, the thing is, as we said earlier, like in the UK, it's so unregulated. But if we think about it, you wouldn't give a pair of scissors to any random stranger on the street and say, cut my hair. And it's something that grows back. Why would you let someone without the medical training to inject things into your skin?
So true.
So, yeah.
I mean, on that note, one thing that has become more popular is people going to surgeons in Turkey. Some of whom do very good work and are good surgeons.
Yeah.
Some of them are not such good surgeons and are unscrupulous. I mean, obviously, that would be the case in any country. But Turkey has really leaned into its cosmetic surgery industry.
Yes.
How are you seeing that reflected back in the UK?
So previously, there have been a lot of patients who have been to other countries like Turkey, for example, and came back with no follow-up. And sometimes, they get infection or certain reaction to whatever that was done, and then needing medical care here. That can be life-threatening, right? But what I see increasingly is that a lot of clinics or practitioners, especially in Turkey, now have a collaboration with clinics in the UK to provide that follow-up and the aftercare, which I think is a good move. I think the attraction when it comes to surgical or aesthetics tourism, so to speak, is mainly down to the cost, right? But, it is important to remember that, your time is also money. And sometimes for all this sort of medical tourism and things like that, you often need to stay in a different country for 1 to 2 weeks, right? And if you get it done in the UK, there are very good surgeons in the UK as well. They're very good medical aesthetics providers. So it's really up to the patient to do their own research and to find the right, the right practitioner for them. And I think that if you were to go abroad for any cosmetic procedures, then it's important that the follow-up is done properly, whether they have a connection in your home country or whether that means you have to fly out, again to have the follow-up and things like that. But never overlook the importance of the aftercare, because that's the most dangerous and also trickiest part of the patient journey. Because if you're not looking after your wounds properly, then you can get infection, and they can lead to things that are life-threatening, like sepsis, for example.
Yeah.
Yeah.
Have you had to fix any dodgy work?
Not from abroad, because I think most of the procedures done abroad are surgical. But in the UK, I have corrected some non-surgical work, mainly fillers that haven't been placed in the right area, or fillers that have occluded blood vessels and things like that.
Are fillers on their way out?
I believe so. I think they will always still have a unique place in aesthetics, because as you age, you do lose volume, and sometimes the only thing that can replace that volume is a filler, right? But I think we are moving away, for sure, from the overfill phase. So the whole pillow phase, overdone lips, overdone cheeks, and things like that. That's definitely out.
Brilliant. Well, thank you so much, Dr. Vincent.
Thank you.
I've been journalist Helen Mariel Thomas. Thank you so much, Dr. Vincent Wong, for joining us for The Spills, and we'll see you next time.